That's a big, yeah, absolutely. Well, and we're talking about these issues right now, and I think it's fair to say, at least for myself, I don't think I fully understand what's going to happen, what's not going to happen, what's just bluster, and what is actual, reality. Imagine now being a senior who's not involved in the healthcare industry, who isn't, tech savvy, who, maybe is a little cognitive decline going on, and them trying to understand and comprehend all of this. I mean, the anxiety that it must induce has got to be just so traumatic, And one thing I was going to say about all that is, but yet we don't hear about any of the effects. We hear about effects on, the markets and our industry and trade, but we're not hearing any really direct effect or implications on our vulnerable population of seniors and people with severe health issues. That hasn't been discussed that I'm aware of.
Well, and the ripple effect is not just them. So if you're caring for somebody and you're hearing about, oh my gosh, this is going up, this is getting cut, they're scrambling and their minds are not shutting down at night. So now they're losing sleep. They're trying to get a hold of their financial planners to pull money out because they're not trusting the markets. I mean, the levels of all of this are so massive. And if we lose our caregivers, and we know stress kills, then we're really going to have some issues,
Right.
in terms of who are taking care of all these vulnerable adults, because they're not all in, assisted livings or nursing homes or wherever. Many are living at home.
Right.
And that, supposedly is where everyone's leaning, is how do we let them live at home longer? We're kind of shooting that whole concept in the foot, in my opinion, in a lot of ways, by the environment that we're dealing with, and that we're creating. And things like, I heard, like, again, this stuff comes up in some of my support groups, is they're cutting fire and police and EMT funding. Well, they call them when someone falls to help them get them picked up and off the ground, or when there's an emergency, to feel safe. And, are they going to be there if they have a fire, or a health emergency? Those things weigh heavy on people's minds.
Absolutely. Well, and a lot of people pick homes and communities based on their emergency services and access to them. If you live in a community that has one fire truck and one police officer and one ambulance, you may look in a different community that has better support services. If you have children or somebody, that's vulnerable or has, declined health needs, you want to have that safety net there for any sort of situation. And underfunded EMS services are already struggling to keep up with inflation and rising costs, leading to these shortages and reduced access for seniors.